decompression therapy, quantity of visits. The thing with decompression therapy is it is very individual. So one patient can get results in under 10 visits and feel fabulous, and another patient may need 24 visits before they feel results, and they might not feel 100% better till after they stopped treating for a month. So it's very idiopathic. What the patients are different. What we do in our practice is we try to get you an MRI, or you bring in your MRI, and I look at how many discs are involved. We try to determine if you are a candidate for the care, and we have about an 85 to 90% success rate if we do take you. That being said, the care needs to be done methodically. You should not be randomly treating your spine under decompression therapy. It's more serious. You need to take it more seriously than that. So you'll want to get a few sessions in a row, half a dozen to a dozen. If you're just beginning care, I get more specific once I've seen that MRI. The rule of thumb is if you just herniated your disc, it's a brand new injury, you may be able to repair one disc, and you're under 30 years old, you can get yourself repaired in under a dozen sessions. Now, I've had patients in their 40s get their care done and corrected and completely cured in under 20 sessions. So it really depends on the patient. So I can think of several patients that got completely better, but we don't know necessarily what your number is when you're in a lot of pain. We look at what your MRI and your x-rays look like, and we try to determine, okay, this is the right amount. So it's important that you do have an MRI, and once you do start your therapy, you want to not randomize the care, otherwise you're going to get random results. You'll want to drink a ton of water. You want to take your fish oils because you want to reduce your inflammation. You cannot be a smoker. You really shouldn't have had a heart attack within a year coming under care. You can't have any fractures. You don't want to have any autoimmune disease you're dealing with when you're doing decompression therapy. You want you as healthy as possible so we can get that blood flow to go in and restore the disc. You see, when you're doing decompression therapy, you're restoring disc health, which is vasculation. So we need good positive energy. When we energy flow, like nerve flow. We also will have you buy a back brace because it needs to hold up your rib cage off your disc when you get off the table so that you can have better results. And then the other thing is you want to vibrate on a vibrational plate right after your treatment, and we do that in our office. So we also want you to be taking B12 vitamins, and you want to be on a liquid fish oil so that your body can permeate that oil and help your inflammation go down as quickly as possible. We don't want you to be smoking any cigarettes because that's going to dehydrate your body. So decompression therapy is wonderful for herniated and bulging discs. It can really restore your body. Patients that are older, like 60s, 70s, they enjoy the care because they feel like it's turning the time back on their back clock. And they've had wonderful results where they feel like it's keeping them ahead of the aging game because it's help hydrating those discs and restoring the body, even though they're older than they used to be. Decompression therapy requires that you drink water. You need to try to drink a gallon of water a day. If you cannot do that, you want to get as close to it as you can. I've had patients do the care and not drink the water. That's a big no-no. And then you also need to expect that for your decompression therapy, you're only going to treat it 4 to 6 weeks typically, and then you're on your own. And what you're going to need to do with that is we follow it up with chiropractic posture care and adjustment, but you also need to be training your core. Your core needs to be given the time and energy to stabilize the care that you just received, and that's up to 6 months to a year after you've stopped treating. You've got to stay with your core, strengthen your routine so that you can keep the muscles, tendons, and ligaments around the disc that you just healed from going backwards again. So if you have any questions about decompression therapy, give me a call. We do a free consultation. If you have an MRI and you want me to look at you, I will not charge you to look at your MRI and do a brief examination. The therapy does cost money. It's around $200 per visit. So it's a very serious cost involved. For some people, that's a lot. So we take it seriously when we recommend the care and let you know the pros and cons and the risks. But it's rarely covered by insurance. It really just, you have to have workers' compensation, an adjuster may approve it, and I have had some payments from some work comp cases, but most of the time it's just cash. Your body, it's considered a LASIK type thing, an elective procedure. Even though it could potentially prevent you from surgery, it's definitely not a guarantee. I'm Dr. Amy Bend. If you have any questions, give me a call. If you want to see me, I'll give you your free consultation. Just let me know that you let my staff know when you call in that you're wanting to do decompression therapy consultation, and we'll be happy to look at you. Thank you. Okay. Oop.